Hello, and welcome to another edition of Colorectal Cancer Canada's Tush Talks. Colorectal Cancer Canada is the nation's leading not-for-profit colorectal cancer patient group, and Tush Talks are our informal conversational video series where we provide information to you, colorectal cancer patients, survivors, caregivers, and your families, and basically anybody else who's interested about the information that you need. Today's guest to talk about queer concerns in the Two-Spirit LGBTQI plus community around colorectal cancer Canada from Queering Cancer is our good friend Kim Meeking. Kim is the co-lead for Queering Cancer, a grassroots partnership dedicated to improving cancer care for Two-Spirit LGBTQI plus individuals. Kim is a radiation therapist by background with over 12 years of experience managing oncology clinical trials in the UK and Canada, along with 5+ years in the not-for-profit sector. They hold a master's in clinical and health research, and their interests focus on fostering inclusivity in clinical trials and enhancing cancer care for Two-Spirit LGBTQI plus populations through education, community supports, and community-based research. So it kind of goes without saying that I'm very, very, very happy to be joined by you today, Kim. How are you doing?
Oh, thank you, Carl. I'm doing really well and I'm excited to be here. And thank you for that introduction.
Yes, and to you and to those who celebrate, happy Pride.
Happy Pride, everyone.
So the talk today, I think, is a really interesting and a really rich topic that should be explored all the time, not only in June, I will say. Um, but that's one of the reasons that your organization, Queering Cancer, exists. So do you want to tell me a little bit about Queering Cancer so folks can kind of situate where you are in the not-for-profit cancer landscape, you could call it?
Yeah, of course, Carl. So the organization Queering Cancer is about 5 years old. It was born out of a research grant to Canadian Institutes of Health Research to explore a knowledge gap. And the gap was that the 2S LGBTQ community are often left out of cancer supports and information. It's just historically overlooked, right? And this leaves the community isolated and missing out on really kind of valuable and important supports. So Queering Cancer was born to address that gap, and it's a community-based organisation, so ran by myself and my wife, and working with community partners who have lived experience of cancer, academics and researchers. And as I say, we're involved in community-based research projects to create resources that patients need and want. And we also curate patient stories to help folks feel a little bit less isolated, hopefully, in their cancer experience. And we also do some education for healthcare professionals, because often that's a real key part that's missing in their curriculum. In training to be a healthcare professional, this isn't often given a lot of attention, so we try and fill that gap.
Yeah, we're going to actually talk a little bit about that, I think, later in this conversation. But I just want to sort of say all the work you do is really, really wonderful and really important. And kind of one of the reasons that it's important is, at Colorectal Cancer Canada, we talk a lot about kind of core pillars of prevention, awareness, education, and, support. Awareness is a really big thing when it comes to screening. And in our kind of pre-show talk, we were talking about kind of one of the core issues among the queer community is there's really low screening rates for cancer.
Mm.
Do you want to talk a little bit about why that is?
Yeah, so the community are less likely to attend for cancer screenings of any time really, but particularly more intimate cancer screenings like colonoscopies and pap smears for cervical cancer. And this is as a result of really a bit of a history of mistreatment by the medical profession towards the 2S LGBTQ community, pathologizing homosexuality.
I think only in
And
the most recent DSMV it was like no longer considered a mental illness, right?
yeah, certainly for transgender folk, that was relatively recent. So yeah, there's this history and a considerable mistrust, which causes people to avoid going. to attend screening appointments. And there was a study in the USA actually fairly recently that looked at colorectal cancer screening rates. So the state population rate was about 65%, and they found that the LGBTQ population were attending at a rate of about 29%, so significantly lower. So yeah, there's the barriers because you anticipate discrimination from the healthcare service, right? A lot of people have had poor negative experiences in the past that holds them back from wanting to attend. Um,
It's very complicated because like there's also elements of like you mentioned it being sort of intimate screenings where it's like I can imagine that somebody wouldn't want to necessarily out themselves if they're not feeling ready or like not know the doctors, not feel comfortable with the doctors and how they'll respond. It makes a lot of sense why those sorts of barriers would
yeah.
exist. What do
And for
you think
somebody
are,
that's,
sorry, go ahead.
sorry, no, for someone that's had gender affirming care and particularly maybe some surgeries, they may be presenting in that appointment with anatomy that the healthcare provider is not expecting. And you can imagine the fear of judgment and embarrassment and stigma around in that sort of environment as well. So
Yeah.
there's a lot of understandable reasons why people are held back from attending.
And then I feel like it kind of becomes this negative feedback loop almost of like you don't go to get screened, healthcare providers don't know the information, so then they don't get the experience, they don't get the visibility, you don't get the visibility of seeing people go do screening. Like, yeah,
Yeah,
I mean, we'll talk about resources later, but there was something that I saw from the RHO, I'm just going to pull this up. The Rainbow Health Ontario. They had this resource that was like explicitly framed as going to get screening is good for you, but also just like to be seen, to be visible. Have you seen this?
yeah. Yeah, it's a really recent campaign, isn't it? It's lovely. And this is a kind of crucial thing that's missing from most screening campaigns is they tend to be developed with this cis normative, heteronormative lens, which means they are targeted towards the majority of the population, cisgender people, heterosexual people. And often we are not represented in those screening campaigns. And it sends this unintended message that that campaign isn't for us, right? If you can't see yourself represented, then you don't engage with it, that message. So I think what Rainbow Health Ontario have done is fantastic here.
Yeah, and also I think it calls on this sense of like this desire to be visible, right? Like it's not just for you for your health, but it's like for pro-sociality. Um, yeah.
Yeah, yeah, 100%. Yeah.
Um, yeah, and I think we have a couple of ways we can go forward here. We can talk about kind of like ways of increasing visibility and participation in screening, or we can sort of talk maybe about some solutions and practices a little bit later if you want to maybe go through other steps of the cancer journey and where it might be different for people in the 2S LGBTQI plus community.
Okay, so I was thinking about this, and I think it's important to think about the treatment, right? Because that can be surgery, chemotherapy, radiation therapy, or a combination of these. And they all present kind of unique challenges for the 2S LGBTQ community and the healthcare providers that are trying to care for these for this community. And for going through treatment, oftentimes it's multiple days, right? Sometimes it's daily, on a daily basis. And imagine that fear of discrimination, but that's happening on a daily basis in the hospital. You know, it really can mount up. You often experience microaggressions, which maybe being misgendered, um, being called by a name that you don't identify with is not uncommon. And that happening repeatedly obviously really mounts up and impacts on mental and physical well-being. Sometimes it forces people to think about going back into the closet when they're in healthcare environments, if that's a possibility for them. For many, it isn't. Another area that I think is important to shed a bit of light on is around sex and intimacy. Certainly for people that are undergoing radiation therapy, engage in sex and relationships is a really key issue. And for folks that enjoy anal sex or anal intimacy, going through cancer treatment can often make that impossible, very, very difficult or impossible. And it's rarely talked about, right? So folks in the community will be less willing to bring this up, not feel safe to do that, feel fear of judgment. And healthcare professionals have a significant barrier to addressing this, their own embarrassment, maybe a fear of making mistakes, or causing offense can hold off these conversations from happening. That leaves people feeling really isolated and not supported in managing their side effects from cancer treatment. So I think that's a gap that we really should be able to work on. And of course, it doesn't just affect the 2S LGBTQ community or gay men, bi men that have sex with men. This is
Yeah.
any sexual orientation or gender identity affected.
Well, it's something that comes up a lot around talks uh for us with patients around like ostomies and like the colostomy operation. Like it's a big question that people have. And part of our sort of education and outreach work is like we've just maybe last year and a half ago developed and released on our kind of return to normal post cancer guide, a book all about sexuality and intimacy. So it's like people have this concern.
Yeah,
Yeah, and like even putting this out with, and I think our guidebook was more oriented towards the cishet community. Like
yeah,
even that felt like groundbreaking in a way,
yeah,
where it's like this needs to be so much more normalized just across the board.
yeah.
Yeah. So how do we do that?
Oh, yeah. So education. So your resource sounds super important piece of that puzzle. Education is huge. And if you look at the medical curriculum, I think there's around 5 hours of content that relate to us LGBTQ plus health. And for
That's
nursing, it's
not very
even
much.
less. It's
Yeah.
like 2 hours. Yeah. So this has to be kind of an ongoing piece of education, um, from the workplace or from other kind of reputable sources. Uh, I would point to some sources as well, like on our website, we've got an education page, and it's a mix of free and low cost resources that folks can look at. Another one I wanted to shout out actually is Princess Margaret, so pmchosenfamily.ca. So they have a really good educational tools on their website.
Yeah. One of them actually I was looking at earlier today. It's their sexual and gender diversity plus cancer guide, which is this really, really, really long guide about like all different stages in the cancer journey. And like they even have like legal resources and like grant funding and scholarships available for like going back to school after cancer, housing. It's like super comprehensive. And something that I think is really fun about it is that in a lot of these different sections, queering cancer comes up.
Oh, that's really cool. That's nice to know. We love that group and we're working closely with them on some research as well. So I would really recommend checking them out. So education is kind of is what we need more of, but alongside that, there's things like anti-discrimination policies. They should be part and parcel of all of the department's working processes to make sure people are actually protected when they walk in the door from human rights violations, essentially.
And this should be a
Um,
desire, I think, for healthcare providers too, is like how to broaden their own education to serve the people that need care the best that they possibly can, you know?
Exactly. Everybody that's involved in healthcare is there because they want to make patients' lives better, right? Every patient. So a piece of that is inclusive communication as well. So it's really surprising how these kind of heteronormative, cisnormative assumptions creep into our vocabulary day to day. So, like assuming that a man and a woman are married just because they come from an appointment together, it's automatic that we have these biases built in from what we've learned in society. So there's a big piece of work is undoing some of those biases and what we think about as kind of neutralizing language. So taking those gendered terms and switching them out for like a gender neutral alternative. So rather than saying man, woman, it might be person, patient, individual, right? Husband, wife. Instead of saying that, you can say partner.
Yeah.
And, you know, it's kind of habit. It's habit that's built up that makes us say these things. So it's kind of changing those habits that makes us be able to undo it.
Yeah, and I know that like so I spend a lot of time in the States and there's a big moral panic in the States around a lot of this stuff. And something that like people really latch onto is like a person with a uterus rather than woman. They're like, "Whoa, that's wild." But it's like accurate. It is more accurate to
Mm.
describe.
Yeah.
Like it is more accurate to real life to use these more neutral terms because people
Yeah.
have tons of different kinds of bodies.
That's right. And I think it's key to remember that the language needs to be medically relevant. It doesn't have to be gendered, but the medically relevant piece is like non-negotiable. But the gendered piece isn't essential, right?
Yeah, in a lot of cases. Well, so let's say that like I am going to go get screening and I might be nervous about how, the doctor will react to me, or I'm not feeling confident, or I've had a bad experience with a healthcare practitioner before around gender or around presentation in some way. Um, what are steps that I can do to go get the care that I need, even if
Okay.
it's maybe entering into a trickier situation?
Yeah. Yeah. Good question. Okay, I think there's a few things maybe that we can do to kind of empower ourselves in these situations and take a little bit of power back from healthcare. So one thing that you can actually do is phone up ahead of time and request a double appointment. If you need longer, so you can make sure that your questions are answered and you don't feel rushed. You can also ask for your session, your clinic appointment to be at the beginning or the end of the clinic. And this could mean less hanging around in the waiting room because that can build anxiety, right? And you might just want to get in and be able to leave. Um, another important thing is like asking a trusted person to come with you. And this is not just someone that can take notes, right? That's super important to help remember the things, but also someone that can advocate for you. If you're feeling anxious and less able to advocate for yourself in this setting, then somebody that you trust could be there and help correct any misassumptions that are made. Like if you were to be misgendered, for instance, having someone by your side through that could really make the difference.
Yeah. At
And
CCC, sorry, go ahead.
no, I was just going to say, tell the person that's doing the procedure what language you're comfortable with them using. Maybe that's to do with your pronouns that you use, the name that you choose, or how you label parts of your body. That sort of stuff is important to be able to communicate with the team to make sure you feel as comfortable as possible.
Yeah. At CCC, we refer to this kind of thing as self-advocacy. And like, kind of again, just to refer to our sort of pre-talk briefing, I made this comparison to like, I recently renewed my lease and I negotiated the rent. I negotiated the rent down. They were trying to increase the rent. They weren't able to. And that's because I had heard like a month before somebody say the term lease negotiation. And I was like, you can do that? So I think thinking of this as like you can make demands, you can make requests, you can make space for yourself in a medical context is like a little scary. Got to be brave to do it, but it's taking power, like you said. It really is like you're empowering yourself. It's you're asserting your agency, which is possible, which people might not think is.
Mhm. Yeah, and getting support in doing that is so important. And so I encourage folks to phone up in advance and talk about concerns around the appointment and try and plan ahead in advance as much as possible.
Yeah. In terms of support, like, we've talked about sort of bringing in the community for developing materials, but are there sort of community-based supports that you're aware of for people in the queer community around cancer care, treatment, this sort of thing?
This is cool because this is an area that we've really seen grow in the last year or so, I would say. And yeah, there's a few awesome groups that are running specific LGBTQ plus, 2S LGBTQ plus support. So one is Young Adults Cancer Canada. So they have a monthly online session specifically for the community, and it's very informal, low key, and absolutely awesome facilitators there. Um, Wellspring is another one. So shout out to Wellspring. So they run two support groups, queer and bi men and queer and bi women. And both of these groups are trans and non-binary inclusive. Again, they're online support groups, kind of drop-in format, pretty informal. And I just learned about a colorectal cancer specific one in the States called
Oh,
Colon Town.
oh,
Have you heard
cool.
of Colon Town?
No.
Okay. So this group, they have like hundreds of different forums, online support forums for folks affected by colorectal cancer. And one of them is a pride group. And I've connected with a trans woman with colorectal cancer that uses that group, and she confirmed that they're super inclusive, and won't tolerate any kind of discrimination, and so recommended that one as well.
Awesome. Yeah, and for folks listening also, that's one of the things CCC offers is we have patient support groups. We have a group dedicated to young early age onset colorectal cancer patients. And we have I think that's on Tuesdays. If you go to our website, you can see that we have a few offerings. And none of them are explicitly like queer specific spaces, but the people who run them, our social workers, are lovely, inclusive, thoughtful people. So I would also encourage you to check that out. The thing about like community that is really, I think, rich and interesting, especially when it comes to like trying to work with marginalized groups, marginalized communities, is that like in a lot of cases, these are communities that are tight knit, that are, kind of out of necessity bound together and have a lot of resources and have a lot of tactics to share. Like I think of the queer community, we've talked about immigrant communities on this show before, and it's like these are resources that exist for the community, but also as a base to like do really great outreach and for larger national organizations to reach out to and to be like, how can we help you? How can we help make your voice heard? How can we speak for you or with you in like larger policy programs? Like, and I think that is something to flag is that these communities are resources for the members of the communities, but also for like the broader Canadian community. It's like good and cool. That's my strong position.
I am in agreement. And coming from this position with queering cancer, we're such a tiny, tiny group, and we're representing a small minority of folks affected by cancer. And we need to partner with big organizations. We need to be good friends with big organizations to be able to, like you say, get the message out. Work with folks that have got a bit more infrastructure in terms of support groups, and really harnessing the power of our community and the strengths within that to kind of bring everybody forward, right?
Yeah. And to when things do get tough, you can fall back on people who understand and I think the ideal situation is having that pool of people who understand and care grow and grow and grow and grow. Because
Uh,
I
we
think,
need our allies, don't we?
yes, we talked about the sort of treatment path, a little bit of like screening and then in treatment. And was there anything that you wanted to look at or talk about in the kind of like recovery and remission post-treatment phase? I realize that's something that we may have skipped over.
When it comes to end of treatment, quite often that can mean for people the end of some of the support that they've been receiving. And with the queer and trans community already kind of lacking tailored support, it just kind of makes that situation that bit worse. In the survivorship post-treatment, there really are very few resources that are tailored to the community in that space. I don't
Yeah,
have too many
so
more things on that.
yeah, well, I think speaks to an area where there does need to be more work and more resources generated for folks. Um, Yeah, we're coming up actually on the end of our time, the end of our little chat. But before we go, I was just wondering if there's anything that you really would have wanted me to ask that I didn't get a chance to, or that you wanted to share that you didn't get a chance to share.
I guess I would maybe have a bit of a call to action for healthcare providers that are engaging in the Tush talks and just say that we really do need allyship in the community and um, also to say that small actions make a big difference. So small changes that you can make in your kind of everyday language in terms of using less gendered terms really does make a big difference in terms of making spaces more welcoming. Um, I also would say that trust takes absolutely years to build up. You know, our community has suffered a lot of mistreatment in the past, and that trust can take seconds to break down. So I guess remember that in interactions and building trust and how important that is, and your role to play in that. And thank you as well for allyship.
Yeah. I want to second that, and also maybe throw the last word to you for where can people reach you? Where can people find your work? And I guess those are the two questions, but
Okay. So come and see us on Instagram at Queering Cancer and also LinkedIn. Those would be the two places where we're interacting. And we've got our website. And I'll give you my email address, Carl, so you can make sure that's available so folks can reach out if they've got specific questions. More than happy to chat. We'd love to hear from the community.
absolutely. Yeah, and I think in the bottom in the description we'll have a link to Queering Cancer, and maybe to some of the resources that we talked about, the Princess Margaret
Yeah,
stuff,
yeah,
in
let's put that
particular, I
in.
think would be really great. And maybe just one sort of final takeaway that I think I would like to share is that like seeing all of this stuff, all these resources, people are working on this. People care about you and want you to be healthy. And I know I do. I know Kim does, and all the people who work on these resources do. So it's, you're not alone, and we care. So I think on that, I've been Carl Bindman. This has been Kim Meeking, and happy Pride.
Yay.